Hello, I'm Mark Rockoff, and I'm the Vice Chairman of the Department of Anesthesiology, Critical Care, and Pain Medicine at Boston Children's Hospital, and Chairman of the hospital's Archives Committee. Today is March 27th, 2020, and I'm speaking from the hospital at a time of great concern in Boston and around the world due to the rapid spread of the coronavirus, COVID-19, with its resultant significant morbidity and mortality. This is all occurring despite drastic public health measures to close businesses, restrict public gatherings, and limit interpersonal contact. Everyone is frightened by these events, and so many people are getting sick and dying. And currently, there are no proven therapies or vaccines, and testing for the disease, especially among asymptomatic carriers, is still quite limited. It's a particularly challenging time for individuals who are expected to continue working through the pandemic, including police, firefighters, grocers, and many others, especially those in the healthcare professions, doctors, nurses, pharmacists, therapists, and the many, many other individuals who work so diligently behind the scenes to keep hospitals and healthcare facilities open and operational. Caregivers are concerned not only about the health and safety of their patients and themselves, but also that of their family members, fearing that they might transmit this highly infectious disease to them when they get home from work. Because of all this, it might be useful to hear directly from a healthcare worker who treated patients during another pandemic that occurred during the lifetime of those of us who are senior citizens, specifically the last great polio epidemic that occurred in 1955. Speaking with me today is Claire McCarthy, who was a recent physical therapy graduate in 1953. Although sporadic cases of polio had occurred throughout the early 1900s, little did she or anyone else know that less than 2 years after she began working at Boston Children's Hospital, a flood of polio patients would arrive here and at other facilities around the world, with more than 2,000 children in Massachusetts alone acquiring this dreadful disease in the summer of 1955. This was just before the Salk vaccine was introduced, leading to the rapid elimination of polio nearly everywhere in the world. Claire remained at Boston Children's Hospital for a long and distinguished career, eventually becoming the head of the physical therapy department here. And although now retired, she continues to serve as a member of the hospital's Archives Committee. Before we begin, it's important to note there clearly are many differences between the polio and coronaviruses, especially in terms of those who are most likely to get infected, the risks of getting infected, and the consequences of infection. Nevertheless, the experience of a healthcare worker dealing with a contagious viral epidemic might be useful for others to hear, especially at this time. I therefore am very grateful to you, Claire, for speaking with me today. Let's begin by me asking you a few questions. Since there was no vaccine at the time to prevent individuals from getting polio, were you and your colleagues worried about acquiring this disease?
Well, in 53, 54, not so much. I think we were aware, as everybody in the city of Boston or in the United States, we were somewhat accustomed to having a polio outbreak somewhere in the country. No one knew where it was going to be or when it would really start. We were, at that time, parents and families were very aware that of the season. If they thought that an event was happening, you're going to a pool to swim was limited. You were sort of advised to stay out of crowds, not to get involved, stay away from people who had colds, don't let them cough. And again, wash your hands, do all of that was just a part of going through the summer months as I was growing up. And so to decide you were going to work in hospitals and things, you kind of accepted the fact that you had to pay probably a little more attention and be aware of the people around you. So it wasn't as fearful, I think, as probably what people are experiencing right now.
Can you describe your memories of the beginning of the large polio epidemic that occurred the following year in 1955?
Well, I remember because one of the good things about working on the division and being part of the division team is that you talked a lot. And I recall Dr. David Grice, who was the attending orthopedic surgeon that was in charge of Division 36, telling us that this is going to be a tough year. And that was about March. And I remember asking him, what does he mean by that? And he said, well, we've had a few admissions, and they're kind of steady admissions, and it's a little bit too soon for that kind of activity. So he was projecting that if this keeps up with the amount of number of admissions coming in and the steadiness of that, there was no interruption. It seemed like there was an admission like every day or two starting off. That then turned into steady admissions every day. And he just knew this was going to be a tough year. In fact, we were warned, he said to us, I can remember, he kept reminding us throughout the season that number one, stay healthy, eat well, sleep, don't party too much, and you take a vacation. You are going to have to plan a week's vacation because you can't keep up the pace of the work that you were going to have to do. You had to stay well. So we said no month's vacation, but a 1 week vacation would be just fine. And that was his advice, and it's the advice I would give to anybody right now, is that they need to keep their own health up.
Okay, how bad did it get in that summer of 1955?
Well, I would say at its peak, every bed in the hospital, on any given day, let's just take a Tuesday. On Tuesday, every bed in the hospital was a polio patient. In some state, either they were in isolation because they were febrile. They were on all the other divisions that would be like non-febrile, afebrile patients. And admissions were coming in. People, cars were lined up on Longwood Avenue and Black Sand Street seeking admission to the hospital. They were in some state of really being febrile or afebrile, but they were there. And we had physicians were doing evaluations or admission or whatever, which turned what I term triage. They had to triage out in the street, and sometimes they were there till 10 o'clock at night doing evaluations and assessments with flashlights. It came to the point at one key point that they had to discharge someone in order to admit somebody that they thought needed to be admitted. So sometimes the census of the hospital, I think, was over because some of the patients had not been discharged yet, but there were people being admitted that were going to be taking those beds later on in the day. So it was quite a stress. I would say that's one of the big stresses on the medical staff.
There are any times when there were so many patients that you literally could not accommodate them in the hospital? And if so, what did you do?
Well, I think that's when they overloaded. I think they would, and that's with the stress, I think, on the medical staff to triage. I think of that often, to have to make that decision to send somebody home. And I think that's when the VNAs got involved with making visits to home almost immediately, and they became part of that acute care during that big epidemic of 55.
Did you have enough staff in the hospital to take care of all the patients that were coming in?
Well, one of the things we had going for us was the National Infantile Paralysis Foundation, which supported volunteers. and I know we had volunteer therapists that were either instructors in the schools that came to help. People hospitals sent some of their staff to us, but volunteers were coming in to supplement the staff in order to handle the capacity.
Were you or any of your colleagues afraid to come to work because you might catch this disease?
Well, I think we would probably definitely concerned and probably a little bit nervous at times, but somehow the atmosphere that was driven in the hospital by experienced staff that have worked there for a while and have seen at least some acute polio patients, were confident. You were in a confident, and I felt that I was in a confident environment, that if I needed a question answered, I was willingly given the information that I needed to proceed, and everybody gave you confidence that what you did was good. You had that confidence that I don't know, it's an intangible thing to try to explain. Plus, I think the volunteers that were coming in that sometimes had more experience with polio than I did were willingly taking directions relative to what they needed to do to fit in with what was expected at Children's Hospital. So,
did you know at that time how polio was transmitted?
No, we did not. And that's why we were cautioned, like people are being cautioned now, to stay out of crowds, keep your distance, sleep, get your sleep, eat well, don't party too much, don't party at all, really. But we were in basically the same situation, not knowing exactly how the virus was transmitted.
Did you take any special precautions? For example, did you wear a mask at work?
Well, one of the things that was actually a regular station at Children's, we wore our clothes to work. Then we changed into, particularly that year, scrubs. Not the scrubs they have now. This was just a white, almost like a dress with a tie in the middle that you tie to work. And when you get through for the day, you take it off and put your street clothes back on. That was one of the things we did. I don't ever recall wearing a mask, even when I was on the isolation unit doing partial exams on acute patients to document the extent of what the virus was doing, what the extent of the muscle weakness, the pain level that patients were having in the convalescent unit. We changed the scrub gowns that we were in when we got out of the patient's room that was acute. And there were sinks everywhere. There were sinks in every room. There were sinks, I think, about every 25 feet that you would scrub, and you were expected to scrub. And you scrubbed when you came out of an isolation room. You scrubbed when you were in there and you were leaving.
Well, Claire, you described to me in the past when you were in an isolation room with a febrile patient and you had to take notes, you wouldn't bring your notes out of the room. Can you explain that?
Oh, no. Nothing left that room. Nothing left that room except, and I don't think as we switched scrubs, our attire, as when the minute we went out the door, you changed. Any papers that you needed to record were pasted on a window, because all the rooms had windows, doors, glass on the door or windows. You would paste it on the window. When you came out, you would copy it on another friend, or a friend would copy it, and but you had to sign it, things like that. That's what was nothing left that room.
in 1955, the only respirators that were available were iron lungs. What was it like taking care of those polio victims who needed treatment in an iron lung?
Heart-wrenching sometimes. I think that was one of the, in a way, one of the benefits that we were estimating the progression of the disease in what was occurring in the spinal cord as it's reflected through muscle action. That if you were judging where the virus was attacking in the spinal cord, you could project what may be happening in a day or two, or what you need to be concerned about. So if you, for instance, had weakness in your hand and you were looking at the radial nerve and the ulnar nerve as it's reflected in the triceps, and the triceps was getting involved, and then you moved up to the deltoid, and that was getting involved. It was an indication that that virus is moving upward and going close and could possibly proceed into the neck and then into the cerebral area. When you started to identify that it was arriving at the deltoid and looking at cervical musculature, and the assumption was that they may very well need to go into an iron lung.
Do you know if elective cases or other kids who needed surgery for appendices and things having nothing to do with polio, do you know how those were handled when the hospital was so full?
It's the peak time, like in July, things like that. There was one, they call them wards, one floor was in the Honeywell building, which is physically away from the other patient buildings. I think it was either the second floor or the fourth floor of the Honeywell building was used for emergency admissions on other than polio patients. That was it.
Well, I'm sure it was extremely challenging working through that summer. How did caregivers hold up during that period?
I can't recall. I can't recall anybody leaving because it was difficult for them. I can't speak to that totally. I just know that working in the contagious area for polio and doing that routinely every day, that would be the unit that most people would be fearful. And I guess we were nervous about it. I can't say I wasn't, but somehow the confidence with people saying that this should contain this, if you do this, this, and this, and you stay healthy and you get your sleep and you pay attention to any that you're getting, that you just had that confidence. There was a confidence that permeated the hospital that the people knew what they were doing. And somehow, being a 2 years experience, you have faith in that because the confidence was there it was just seen and felt. I don't know how to explain it more than that.
What is your recollection of how this epidemic ended?
It gradually dissipated. I think it was like the virus in what all the polio epidemics were like. I mean, they started off and you got acute and you died out, and then the virus just ended. So generally speaking, by September, October, people were mostly in the afebrile stages.
Do you remember that year of 55? Did the schools open in time in September, or was the epidemic still going on then?
The Boston school system didn't open until the end of September.
How long did it take for things to kind of get back to normal at the hospital?
Well, that's hard to say because the normal meaning that you're not in an epidemic state, I guess, or a contagious state. I would say probably by the end of like October, November, that you were getting more of the usual admissions, and the wards that were in use for polio were diminishing. So the wards were opening up for other admissions, for other types of admissions.
So this was really from March to October-ish. It's more than 6 months.
Yes, but the effect of the 55 epidemic lasted for years, because with polio you get destruction of muscle mass, you get your function is compromised. The one thing about polio, it was never predictable. And every polio patient was decidedly different. The pattern of what happened to an individual was basically different. I don't think I ever saw two patterns the same in any patient. So the challenge is, so the effects were obviously the effects of people who were in an iron lung and recovering. Some could stay out of an iron lung for half a day. Some of them ended up sleeping in an iron lung at home or in the Wellesley Respiratory Center, which was open, where you can't correct muscle weakness, but you can try to reestablish patterns of movement to take advantage of what was assumed the possibility of an 18-month period that there could be recovery in the spinal cord of the disease, the effects of the disease, so that you worked to optimize whatever recovery a patient was getting. But there were patients that optimum recovery just did not occur. And so the care of those patients, I would say it kept the department or the hospital busy for 8 or 9 years, the effects of that polio epidemic.
What do you think was the ultimate effect of this pandemic on you and your colleagues in the hospital, now looking back on it many years?
I look back on it as a period that I learned a great deal. I had a wonderful, it was in some ways a very good experience for a new practitioner, shall I say. I think to see the decisions that people had to make, what people had to help with, contribute to, you were just part of a wonderful group of healthcare workers willing to work, to do their job, help you out if you needed help, would let you give suggestions. They would welcome suggestions. I think there was a camaraderie that occurred within, I would say, the staff of Children's Hospital, and it wasn't just the healthcare workers. I think people who were answering telephones were very much nicer on the phone than they might be sometimes. They were aware that people were all stressed and that you didn't need to make people become more stressed. And so I look back at it as a time that I remember, obviously, a lot of things. I don't think you could ever forget it. So I think the people who are working in this epidemic today, it's going to be a period of their life, a period of their practice and their experience that they will always remember, because and they remember what they were doing, people that they were part of a team. And I'm sure that these teams are operating now, because that's the way I always explain how children's works. It is the team that more or less comes together to do the job they're meant to do. And I think they will feel the same way. It might be tough at times, but I think if they stop to think about it and answer the questions you're asking me now, I think they would give you similar answers.
Well, Claire, based on all this experience, is there anything else you would like to convey to caregivers today who are dealing with the burdens and the fears of treating these viral victims?
I think it's important that if you look back, that you're able to say that you did the very best you could, always. No matter how bad it looked, that you, at least as an individual, were doing your very best, all you could, and be happy that you did that. I looked favorably back at the situation because I learned a great deal. I learned a great deal about myself, on what you had in you, what you were made of as a person. So I think it's a time that they will reflect on it in years to come, and they will, I think, come to similar conclusions that they were involved in. They were in the middle of it. They did the very best they could, and they're proud of it.
Thank you, Claire, so much for sharing your experience with us and for your lifetime of dedicated service to children and their families at Boston Children's Hospital. Clearly, every pandemic is unique, and there is much about the coronavirus that is not yet known. But hopefully a vaccine will soon be developed, like with polio, that can end this modern plague, and hospitals and healthcare workers can get back to what used to be their, quote, normal, unquote, responsibilities. I vividly remember standing in a huge line outside my neighborhood school one weekend day with my mother and younger brother when the first polio vaccinations were being given out, which everyone viewed as a godsend. Perhaps many years from now, when the coronavirus epidemic is just another story in the history books as well, those involved in dealing with the current crisis will be able to relate to the next generation their experiences dealing with this enormous healthcare challenge. To everyone watching this, thank you, be safe, and may this too soon pass away.